This is KTVO's Good Morning Heartland.
And welcome back. We've heard a lot about health reform for the last decade or longer. This year, a further provision of the Affordable Care Act came into effect. Some within the medical profession are taking a form of reformation into their own hands. Now, to help us understand this new delivery method, Dr. Justin Puckett is here this morning. So first of all, tell us a little bit about what has prompted medical professionals to go towards this new alternative way of providing health care to their patients.
Well, even back to whenever I was in medical school, we've been hearing a lot about quality healthcare, or that we're going to essentially be revolutionizing the way that healthcare delivery is done and the way that physicians are paid. That's going to focus not on how many people get ran through the mill, so to speak, but really focused more on quality. So if you take really good people, you might get paid a little bit more than if you take okay care of people. And so that's been this carrot at the end of the stick. But here we are a decade later, and we're still talking about those things, but we're really no closer to seeing any of those things come into full fruition. And so because of that, and because we're now seeing with the Affordable Care Act and those changes in the provisions, many people's, especially those who are buying insurance on their own or buying insurance on the marketplace, are being, we're seeing their rates go up. Some from where they were 3 or 4 years ago, a multiple of 4 or 5 times. And so those folks are being forced into very high deductible insurance plans so that they have catastrophic coverage, which is great. But whenever they are looking more for the primary care side, they don't have they don't have any coverage essentially for the first $5,000-6,000, and so they're making that payment out of pocket anyway. And so that's kind of what prompted this. Was I think what really kind of spurred this. The direct primary care movement's been going on for a while. It started primarily in immigrant areas where farmers were hiring doctors to just take care of the group of their migrant workers, and so that seemed to work so well that doctors were just getting paid to come and take care of people, that this whole idea evolved of a membership based. It a little bit comes from that idea of concierge medicine that happened maybe 15 years ago, that really didn't take off much, and that was really kind of more for the rich and the famous. It wasn't for the everyday person. And direct primary care is targeted more towards the everyday person, paying a low monthly fee where that then provides them unlimited and prompt access to their primary care provider. And so that's what's happened. That's kind of what's prompted this direct primary care movement.
Okay, so direct primary care clinics, tell us a little bit more of like what we can expect. Like what would it look like a regular doctor's office? Yeah,
it would look like a regular doctor's office, although instead of having a normal doctor having 3,000 patients, a direct primary care practice usually has a third of that.
Okay.
And by the idea of direct primary care is real hands-on. And so whereas now a physician who sees 40 patients a day and at the end of the day has got 2 hours of insurance mediated paperwork, now there's just no time for that physician to pick up the phone and to return a call. So you get calls from the ancillary staff, you get told you need to come in for an office visit, and that's where the income's generated, is coming in for the office visit. And the direct primary care, the budget's met from the first of the month, and so the doctor's really being, the doctor and the patient's job is to take care of each other. The doctor take care of the patient asks questions, and that those things be delivered at the simplest method possible. If that's a phone call, great. If that's via an email, great. If it's with a online a video chat, that's okay too. And then having high access to that provider, so you can see that direct primary care provider the same day or the next day, and have prompt access. And so that many times people are paying, their membership fee is more than one copay would be to come to the office now that copays have gotten so high, or even definitely more than maybe even they might be able 2 or 3 months worth of membership fees might be the same as one office visit for a sick visit now.
Okay, so you just mentioned membership fees. Now, will somebody that wants to be a part of this, are they still going to need insurance?
Yeah, we absolutely would encourage. I would encourage anyone who's going to look at a direct primary care practice that it's a great delivery mechanism that's insurance independent for the primary care piece, but that doesn't necessarily cover labs and anything else, that hospital stays and X-rays and God forbid something catastrophic happen, a car accident or something of that nature, then certainly having that catastrophic insurance is going to be important. And even those that have insurance that's not such a high deductible, or maybe there are still some fairly good insurance plans being out, especially those who are employed by others and getting group plans. Those folks are really their membership fee, or what they're getting at that level, even with the good insurance, is that high touch, high access to their physician.
Now, what are some downsides to it?
Well, it's an additional cost, and it's a cost of something that you might be paying even if you're not using. And so, but if you do use it, you know that it's going to be there and be there for you quickly. And then there's some folks that just, based upon their budgets, that's not going to work. And then all of the care that's provided in the direct primary care, because it's non-insurance based, it doesn't go against their deductible. And so where now if you come to the doctor and you spend $200 on a cold visit or something like that, then that $200, at least you're working your way towards your deductible. Where in a direct primary care, there's no bill, there's nothing to turn in, there's no insurance, there's no nothing. And so that doesn't count towards that deductible. But unless something catastrophic does happen, most people aren't reaching those $5,500, $6,300 deductibles every year just with their routine primary care stuff anyway. So it really kind of helps spread things out and make it more something that you can really work into the budget.
Now, really quickly, one last question because we are running out of time. You did mention membership fees, and you also mentioned to keep your insurance. Now, would you recommend if somebody, maybe like, how here at KTVO you have like a high, medium, or low form of insurance that you can get coverage, is what I'm trying to say. Would you recommend them going to a lower coverage if they have this direct primary care membership?
If somebody was going to be involved in a direct primary care practice, I think that it's very reasonable to look towards a higher deductible. And oftentimes the savings that you can save there will more than pay for the membership for the direct primary care. But you still got to think about those things outside. So as the deductible goes up, you may be paying a little bit more for your medicines, some of those other things. It just depends on the individual and their out-of-pocket expense and what they're already spending and what they might be seeing in the next year.
Okay, all right. Well, thank you so much. What we'll do is we'll post everything on our website at ktvo.com, and we'll link up your information as well if they have any questions or concerns. Again, thank you so much.
Thank you.
And we'll be right back.